When you're booked for cataract surgery, most people picture the new lens like a part off a shelf. One standard lens for everyone. It isn't. Your surgeon calculates a specific power for your eye, your own number, from a set of precise measurements taken beforehand. And there's one thing that can quietly throw that number off before anyone has even reached for an instrument: dry eye, even the kind you can't feel. I'm Mr. Dilraj Sahota, consultant ophthalmologist with training from Oxford University and Moorfields Eye Hospital in London. Because here's the part almost nobody explains. These measurements can come out unreliable even when your eyes feel completely fine. I'll come back to why and exactly what to do about it before the end. If this is useful, do like the video. It genuinely helps a small channel like mine reach the people who need it. Start with what actually happens before surgery. The cloudy lens comes out, a clear artificial one goes in, and that lens has a power chosen specifically for your eye, like the power of the lens in your glasses. To arrive at it, we measure the eye very precisely beforehand, the length of the eye, the curve of the cornea at the front, and these measurements feed a calculation, and out comes your lens power. So this isn't simply pick which lens you want, it's measure this eye, then work out the right power for it. Here's where dry eye comes in. The curve of your cornea is measured through your tear film, which is the thin layer of tears on the very front of the eye. When that film is smooth and stable, the reading is clean. But when the surface is dry and unstable, the film breaks up unevenly between blinks and the reading becomes less repeatable and accurate. How much? In one study, when the surface was unstable, measuring the same eye twice gave different readings that shifted enough to change the calculated lens power by more than half a diopter in around 1 in 10 eyes, whereas in those eyes with healthy ocular surfaces, it barely moved at all. And half a diopter is enough to leave you reaching for glasses you were hoping to do without after surgery, because the eventual power of your eye shifts off target. That isn't the surgery going wrong. It's the measurement being taken on an unsteady surface. And this is the part that catches people out. You'd assume that if your surface were dry enough to matter, you'd feel it. But in that same research, when they sorted people by whether they actually reported dry eye symptoms, it didn't predict the wobble in measurement at all. It was the objective state of the surface on ophthalmic examination that moved the measurement, not whether your eye felt gritty. So my eyes feel fine is not the same as my surface is steady enough to give a rock-solid lens power measurement. A comfortable eye can still be measuring badly. So there's a window, the weeks before your measurements, and it's worth using for 2 reasons. The first is the measurement itself. A steadier surface gives a cleaner reading, and international guidelines now say this explicitly. Settle the surface before you take measurements. This isn't just theory. In several studies, a short course of proper ocular surface treatment before biometry, not just a bottle of drops, but treatment aimed at calming the surface down, cut the rate of unexpected results after surgery dramatically. In one trial, from around 1 in 6 eyes to fewer than 1 in 20. Plain lubrication on its own hasn't been shown to do this reliably in the short term, which is exactly why having your surface properly assessed matters more than just reaching for dry eye drops yourself. The second reason almost nobody mentions: cataract surgery itself very commonly unsettles the ocular surface for a while afterwards. So if your surface is already a little dry going in, you're starting the recovery from a lower baseline. Getting it in better shape beforehand gives you more in reserve to absorb that hit from surgery. You tend to come through the healing period more comfortably. 2 honest caveats, because I won't oversell this. First, not everyone needs it, and plenty of people sail through without giving this a thought. This is about the large number of people who have a quietly dry surface and don't know it. Second, and this matters more, none of this is a reason to delay surgery you genuinely need. Dry eye is not a reason to put off a cataract operation. The point isn't to postpone, it's to arrive with the surface in its best shape, so the measurement can be as reliable as possible and the recovery as comfortable as possible. This is about improving reliability and reducing risk, stacking the odds sensibly in your favor, not a promise that any one person's result changes. So back to what I promised, why your measurements can be unreliable even when your eyes feel completely fine, and what to actually do about it. It's because the thing that moves the measurement is the state of the ocular surface, not the symptom. Your eye can feel perfectly comfortable while the tear film underneath is quietly unstable. You cannot rule this out just by how your eyes feel, which means it isn't something you can check yourself. It has to be asked for. So here is exactly what to do. 3 things, and none of them take more than 1 sentence. 1, ask the direct question out loud at your cataract assessment. Can you check whether my ocular surface is stable enough for accurate measurements? And treat it first if it isn't. That single sentence hands the clinical decision to the people qualified to make it. That's their job, not yours. 2. Ask it early, not on the day. Raise it as soon as you're referred or booked in the weeks before your measurements are actually taken, not at the pre-op appointment itself when there's no time left to act on the answer. 3. If you already use dry eye drops, keep using them, but don't assume that's the whole answer. Plain lubrication alone hasn't reliably been shown to fix unstable readings. So let your team tell you if you need more drops, rather than deciding that for yourself. That's the entire action point of this video. Ask early, ask directly, and let your surgical team decide what your surface actually needs. You don't need to diagnose anything yourself. You just need to make sure the question gets asked. If you had to explain this at the kitchen table tonight, here it is in 2 sentences. The artificial lens to replace your cataract isn't picked off a shelf. Its power is calculated from precise measurements of your eye, and a dry, unstable surface can make those measurements less reliable, even if the eye feels fine. So as soon as you're referred, ask your team this one question. Can you check whether my surface is stable enough for accurate measurements? And treat it first if it isn't. Most people find that once they ask that question, this is an easy thing to get right. The surprise tends to come after, because that same surface very commonly gets drier for a while after cataract surgery. Even in people who had never had a problem before, and almost nobody is warned. Why it happens, how long it lasts, and what genuinely helps, that's the next video. It's linked below.